Hi, this is Dr. Johnny Nelson with Raleigh in the Bone and Joint Surgery Clinic, and this video is about healing after a shoulder replacement surgery. So hopefully this video will kind of walk you through the first few days and the first few weeks of healing at home after shoulder replacement surgery. There's some other videos about the risks of shoulder replacement and also what to expect on the day of shoulder replacement, as well as the different types of shoulder replacement and exactly what we do during that procedure. But I want to take this because a lot of our questions, and honestly most patients should be concerned about their healing after shoulder replacement surgery and their ability to do so after a shoulder replacement. And that often weighs in on their decision of whether or not to even have a shoulder replacement, right? Is the healing process afterwards. So the first thing is when you get home after a shoulder replacement surgery, which typically you'll be discharged on the same day as surgery. Sometimes you'll stay overnight in the hospital, but when you get home, the first thing obviously is going to be, and the first concern is going to be pain control, right? So with any surgical procedure, and especially a bigger surgery like an open shoulder replacement, joint replacement surgery, is going to be, how do I stay comfortable after healing? And fortunately, we have a lot of great new technology that helps patients heal at home with minimal pain, right? And a lot of that includes the way we perform these surgeries, but also in the anesthesia, right, is nerve blocks that we use that not only keep you comfortable during the surgery, but keep you comfortable even for days after the surgery. So very likely when you get home after your shoulder replacement, your arm and your shoulder will still be numb, and you're going to be feeling really good in terms of your overall pain levels. Now, the most important thing that you need to realize is that even though you're not going to be having any pain and that shoulder nerve block is still going to be working, I want you to realize the processes that cause pain and that are interpreted by your body as an injury, right, which that's what surgery is, like your body sees that as an injury, and those processes are still going on. Even though you don't feel them because the nerves are blocked, that process is still going on. And what does that mean? That means that you need to act like you're hurting, right? So when you get home from your shoulder replacement, I want you to act like you're hurting. I mean, I want you to lay down. Now, typically that's going to be in a recliner, and I'll talk about that, kind of sleeping and resting here in a second, but I want you to lay down, recline back. I want you to put a big bag of ice or put your polar care on that shoulder, and I want you to kind of behave like you are hurting, right? And the main thing I want you to reference is this. Every patient will get a copy of this. It's available on my website, but this is our typical pain control plan. And it's a pyramid because a pyramid has a base and it also has a tip, right? Every patient, before you get to the top of the pyramid, you got to have the base. And your pain control is the same thing. You have to have your base. So when you get home, immediately, even if you have no pain and your block is still working, I want you to be following this base of the pyramid, right? And again, these need to be clear with your medical doctor, but the base consists of Tylenol and ibuprofen, alternating back and forth around the clock, right? So typically 600 to 800 milligrams of ibuprofen, if possible, taken with food. Again, you have to clear that with your primary care doctor, but if you can tolerate ibuprofen, that's what I want you to take. 4 hours after that, you go to the Tylenol. The Tylenol will be 1,000 milligrams, again, clear with your primary care doctor. Do you want to take that 1,000 milligrams of Tylenol, and then 4 hours later, go straight back to that ibuprofen, around the clock every 4 hours, back and forth, Tylenol, ibuprofen. Some patients find it very helpful to set an alarm to go ahead and do that. And until your nerve block is worn off, and you know exactly where you are with your discomfort and your pain, you need to be following that base of the pyramid at all times. So this is labeled always take. So you should never be up here at the top of the pyramid if you're not doing the things at the bottom, right? Now, when that block starts to wear off, or you start to feel some ache and discomfort in the shoulder, it's okay as long as you're doing these things, right, to move up the pyramid, right? And that is going to be a stronger pain medicine. Usually I prescribe what's called oxycodone, and that is a narcotic pain medication. Now, if possible, you want to avoid that. That's only if needed, whereas this is always, this is only if needed. You want to avoid these because they do have side effects. While they will bring your pain levels down, they can make you constipated, they depress your breathing, a lot of different problems. They can make you feel nauseated. You want to start with a small dose, so sometimes I tell you even use a half tablet if possible. And according to where you are with your pain, of course, again, always stay on the foundation. You can titrate up, meaning go up a little bit or down a little bit on the dose of this medication here. You can also spread doses out, right? So once your block has fully worn off, the first thing you want to start doing is you start to kind of go down on the amount of this that you take, and take as least as possible, if possible, none at all. And then with this lower medication here, right, the Tylenol ibuprofen, you want to start spacing those out further, right? So every 5 hours, go back and forth, or every 6 hours, go back and forth, and start spacing those out to where you can tolerate it. Again, none of this will take away all of your pain. We just want to make your pain tolerable and your discomfort tolerable. Now, it also is very important that you're icing the shoulder. We do ask you to either use a polar care. Don't put the ice directly on your skin, because especially with that nerve block on, because that can cause skin problems, blistering, or like frostbite. The other thing I wanted to mention with icing is, so we want you to do ice-free holidays. So we want you to take about every hour, 20 minutes or so of ice-free time where you're not icing that shoulder. But icing should be your default, and especially in the first 5 days to 7 days after surgery, icing can be extremely beneficial. There are other things that you will notice. As I mentioned, surgery, your body sees that as an injury, right? So things like swelling and bruising, and sometimes even a little bit of redness can be a normal phase, normal response to the surgery, normal part of wound healing. Swelling is common. You may have swelling that goes down into your arm or even into your forearm and in your hand and wrist, right? You're going to be in your sling. Now it's important, and I'm going to talk about your sling here in a second, but the sling, I want you to be taking that off 3 or 5 times a day to do those elbow range of motion exercises. So bringing that elbow all the way out straight, right? Making sure that elbow doesn't get stiff. Palm up, palm down exercises, and then power grip exercises. So most of the slings come with a little exercise ball, so you can be using those exercise balls to do those power grips. Now those are great exercises, and do those immediately as soon as your block wears off, not only to keep things from getting stiff, but also to help control that swelling that's a normal part of the wound healing and the surgery healing process. Bruising can also be very common and can be expected after the surgery. That doesn't mean that there's anything wrong, and you can even have bruising into your chest wall. You have bruising that goes down your arm. Different patients are different. Some patients have 0 bruising, and some patients, especially those who take blood thinners, may have a lot more bruising. So bruising is a normal part of the healing process. Numbness and tingling in your fingertips, especially if you've had a block. Sometimes those blocks, even after they wear off, it's normal and can be expected to have a little bit of numbness, tingling in the tips of the fingers. And sometimes that can even take several weeks for that to completely subside. I do want to know about it if you're still having it, especially weeks after the surgery, but it's nothing really to worry about, especially if you're still able to move all your fingers just fine. I do want to mention the sling. I have a separate video about using your sling and your ultra sling, so definitely consult that video. And that goes into resting, sitting on a couch, can you take the strap off, and how to use the pillow, and also sleeping after shoulder surgery. But for the most part, the sling, I want you in the first 2 weeks to be wearing at all times. So the only reason you should be taking your sling off is to shower, which I'll mention here in a second, is to change your clothes, and to do those range of motion exercises that I prescribe for you, right? Hand, wrist, elbow range of motion. And sometimes I do have you start to do some gliding exercises with your shoulder. Those are really the only things that I want you to take your sling off for. Otherwise, you should be in your sling at all times for the first 2 weeks at least. And sometimes for some patients, it's going to be longer than that. But that sling is going to be your default resting device for that healing period. Activities, just like wearing the slings at all time, it's very important that you're not using the shoulder in the first 2 weeks. The first 2 weeks is always a calm down phase where all the swelling, the pain, everything's calming down and healing in the shoulder, and we just don't want you to use that arm during that time. I do prescribe for some patients, including shoulder replacement surgery, some special exercises, including phase 1 or phase 2 shoulder exercises. And if those are right for you, I will tell you. And so sometimes that involves some little gentle joint gliding exercises. I often get questions about cardiovascular exercise, so walking or biking with a stationary bike. As long as you can do it safely without using your arm and you can wear a sling, while you do it, then by all means, it's healthy, it's safe to do that. Going out and walking when you're able to do so, getting your heart rate up a little bit is a good thing, right? So stationary bike is a good thing, and walking is a good thing. Typically you're not going to be jogging or running, but we also don't want you to break out into a really heavy sweat after the surgery, because you're healing that incision, and we don't want that incision to get covered in sweat. In terms of your dressing, so when you come home after a shoulder replacement surgery, you are going to have a dressing on your shoulder. Typically, we try and leave that dressing on. It's going to be an orange dressing, most likely over the front of your shoulder. We try and leave that dressing on until you see me in the for your first follow-up visit around 2 weeks after surgery. Now, if that dressing gets really sticky and it starts to stick to your clothes, or if it starts to fill with dark old fluid or anything like that, it's leaking, give us a call, but most likely it's absolutely okay, especially after 5 days after your surgery, to take that dressing off. Underneath there'll be some little paper strips under there. Keep those paper strips in place. Just dab it with a towel or with a piece of gauze just to dry it off. Let it dry out to air. But typically we like you, if it's clean and dry and it looks okay, to keep that dressing on until you see me in the office. Sleeping is something that is important to think about before the surgery. So most patients will have a recliner or a way to sleep semi-upright. So laying back, while it's not going to do any damage to your surgery, it will probably be a little uncomfortable for you immediately after the surgery. And so typically we want you to sleep semi-upright to help control the swelling in the shoulder. And usually a recliner is best for that. It's also best to sleep with your sling on if possible, mainly because the shoulder sling will keep your arm from falling back, right? So consult that sling video if you have questions about your sling. Yeah, that's sleeping in a nutshell after shoulder surgery. And then follow up after shoulder replacement surgery. I typically will see you back at 2 weeks after the surgery, right? And we'll get some x-rays just to make sure everything looks good with the implant that I put in there. Look at your incision, make sure everything's healing well. And also I want to make sure all your nerves are working okay, and that your fingers are moving, and that you've had no complications after the surgery. So hopefully this video was really helpful for you in kind of understanding the process of healing at home after shoulder replacement surgery. If you have any other questions, of course, don't hesitate to reach out to us. And if you're coming in for a pre-op visit, write these questions down if I don't cover them in the video, and ask me. Okay, take care, bye-bye.